all the food and dietary supplements that we mentioned on this program are intended to contribute to the daily diet and overall health. They're not intended for the use in the prevention, treatment, mitigation, or cure of a disease or health-related condition. Individuals who have or suspect that they have an illness or who wish to commence a diet or exercise program should be consulting with an appropriately licensed healthcare practitioner for their medical history evaluation, diagnosis, treatment, and health recommendations.
Welcome to the Health and Wellness Hour with Dr. Joel Wallach and Pharmacist Keith Abell. They believe when it comes to nutrition and supplementation, the modern medical system has failed you, that our body is divinely designed to repair itself given the correct foundation of nutrients. With a combined 85 years experience in health, nutrition, and supplementation, they bring a unique perspective on how to manage disease and improve one's health. Over the next hour, Dr. Wallach and Pharmacist Keith will discuss health and wellness topics seen in the news. They'll discuss trends in nutrition and supplementation and how you can take control of your own health and your future. Let's get on with the show. I'm Keith Abell, and if you're anything like me, you're short on time, but you're smart enough to know we get one body in this lifetime, so we better not screw it up. You already know how your body works on a basic level, right? It's essentially a chemical reactor. In goes food for fuel, and out comes waste. Sounds simple enough, but we weren't exactly handed an owner's manual at birth, and it turns out our body needs 90 essential nutrients to thrive. In fact, most diseases that we're told are genetic or that only drugs can cure are actually preventable and even reversible if you're getting these 90 essential nutrients. 100 years ago, you got them from food, but today you can't. It's impossible. The soil doesn't have those nutrients, and if it's not in the soil, it's not in your fruits and vegetables or the plants our livestock eats. Even if you already eat right, unless you are supplementing your healthy diet with those nutrients, it's physically impossible for your body to produce what your DNA is telling your body that it needs. What that means is, if that you live and eat in America, and most places on Earth, you are mineral deficient. Now, why didn't our parents or grandparents warn us about this? The truth is, your granddaddy's soil is long gone. The modern medical approach is that it's easier to prescribe a drug to treat a symptom than it is to teach a person how to heal themselves. I don't accept that, and I'm willing to bet that you don't either. So you're probably just as shocked as I was to learn that mineral deficiencies can cause diabetes, arthritis, infertility, age spots, fibromyalgia, birth defects, back pain, kidney stone, even certain types of cancer, and the list goes on and on. There are literally hundreds of these mineral deficiency diseases, most of which we find out about after it's too late, and all of which have been linked to one or more mineral and vitamins that need to be ingested on a daily basis. Here's the bottom line, and this is what the person who sent you here knew that you were smart enough to understand. In this day and age, most Americans will suffer from the pain and cost of nutrient deficiency diseases, but you have a choice. You can correct your body chemistry. You can fix your mineral deficiencies with 90 for Life, a daily health regimen with certified organic whole foods, probiotic, and essential vitamins and minerals. It's the one solution that has all 90 of the nutrients you need to prevent and correct nutrient deficiencies. Now let me tell you about the doctor who developed 90 for Life. Dr. Joel Wallach is the founder of Longevity. He's a Nobel Prize nominated biomedical research scientist, a naturopathic doctor, and an accomplished author, a pioneer in the study of epigenetics, and an expert in nutritional deficiencies. Dr. Wallach got his start in the field of animal studies. In fact, he led the National Institute of Health's project that resulted in him co-authoring a book that's become the definitive scientific work on over 900 animal diseases, a work that's been classified by the Smithsonian Institute as a national treasure. Dr. Wallach founded Longevity to wean the American public away from the medical industry protocol of treating the symptoms while living with the disease and to a more effective protocol of teaching people how to use proper nutrition to correct their body chemistry. Longevity is now a $100 million a year company, publicly traded, with a perfect track record with the SEC and consumers because their products work. 90 for Life is only one of 1,000 offerings from Longevity, and all of them are scientifically formulated and 100% guaranteed. You'll have no trouble finding things at Longevity to make you feel better, look better, and live better. But the first step is for you to correct your nutrient deficiencies, which is why you start with 90 for Life. It tastes good, makes you feel great, and keeps you healthy. So thank the person who sent you here and ask them to help you get started today. Then go back to enjoying your life knowing that a daily dose of prevention does a lifetime of good.
All right. Good morning, everybody. This is Pharmacist Keith with Dr. Joe Wallach. Welcome to the Campaign for Nutrition, Health, and Wellness Hour. How are you this morning, Dr. Wallach?
I'm excited. It's just so great to get started here with your opening comments and stuff like that. You really got it nailed. Okay. And right now, of course, we have an example of what's going on. The baby formulas, because of the supply chain stuff and raw materials not available, and a breakdown in production, all the parents of young kids under the age of 6 months who are, on baby formulas are freaking out. And the doctors are saying, well, don't try and do anything yourself. Just sit there and wait. And, maybe before your baby dies, we'll come up with a supply of these baby formulas. No. For thousands of years before baby formulas were invented, mothers were working and stuff like that. And so, maybe one meal a day or 2 meals a day, or maybe all the meals a day, babies got cow's milk or goat's milk or sheep's milk or llama milk, stuff like that. Because mama was too busy trying to save the farm and so forth, or working someplace. And so they were getting not breast milk only, but they were getting all these variations on baby formulas. Well, now we're having trouble getting the supplies to make these baby formulas. And so I've been dealing with this, I don't know, for 50 years. And as you point out, we have things that can deal with this. Long before people knew what was going on, they were getting minerals, because don't forget, plants do not manufacture minerals. Plants can manufacture vitamins, but they cannot manufacture minerals. And of course, in the old days, before we had electricity, in the mid 1800s, people were putting the wood ashes from the wood stoves and the fireplaces and fire pits into the gardens as a fertilizer. And all the plants, the carrots and the onions and beans and squash and tomatoes would suck up all the minerals that were in the wood ashes. 98% of wood ashes were minerals that the tree had sucked up out of the ground, and 2 or 3% was the carbon. And so wood ashes came from wood stoves, fireplaces, and fire pits. Well, at 3 o'clock in the afternoon, Monday, September 4th, 1882, on Pearl Street in New York City, in the bluff overlooking the construction of Brooklyn Bridge, Thomas Edison pulled a switch in the first commercial electric jetting plant. And within 18 years, by the year 1900, we had like 40 new diseases that nobody had ever seen before. And people were obese, and it was just a big mess. And it was one of those things where doctors are saying, well, you're eating too much animal fat, eat more whole grains. And 1,000 companies came out and started making things out of wheat and barley, rye, and oats, like the breakfast of champions and oatmeal and stuff like that, and all kinds of breads and crackers and noodles and things. And so we had all these terrible diseases. Well, those terrible diseases were caused by mineral deficiencies, caused by malabsorption and lack of these nutrients in the food, because we weren't getting wood ashes anymore. And doctors, don't waste your money on vitamins and minerals. Just eat well, you get everything you need. The 4 food groups, the 7 food group pyramid, that's a sure pathway to death, early death. Okay, you'll lose 25 to 50 healthy years by following that advice. You don't want to go there. And so basically, we came up, with the Healthy Brain and Heart Pack many years ago. And I really knew what was going on when I was working with Marvin Ropp, one of our Marines, who's actually a Marine in Utah and Idaho. And we're curing, I'm going to use the cure word, we're curing kids with muscular dystrophy. And so I'm excited here, because muscular dystrophy in humans is the same disease as white muscle disease in calves. And we knew, and farmers who can't even read knew what to do for white muscle disease in calves, and doctors don't know what to do for muscular dystrophy. So I could see the total difference here in how things were being approached. So I began to treat these kids like we were treating calves with white muscle disease, and sure enough, in 2 to 6 weeks, they were cured. So we'd go to the doctors, and the doctors would test them, and sure enough, they didn't have muscular dystrophy anymore. So we took, I guess it had to be something like 2010, we took all this stuff to Jerry Lewis from the Muscular Dystrophy Association and gave him about a dozen of these charts. And he talked to the doctors and talked to the mothers and talked to the kids, and he was convinced that we were correct. He got very excited, and he went to the Muscular Dystrophy Association, which he'd been with for 50 years. He'd been with them for 50 years. He had raised $2.7 billion, And they fired Jerry Lewis and shut down the telethon. They fired Jerry Lewis and shut down the telethon because he said it wasn't genetic like they thought. It was a simple nutritional deficiency disease, and we could cure all these kids and we could prevent it. They fired Jerry Lewis. And of course, he died within a year after they fired him. Terrible, terrible, terrible story. Okay. Well, it turns out I was correct and they were wrong. Okay. Not only did we get rid of muscular dystrophy, but we also got rid of cystic fibrosis, which is a disease that caused lung disease. It was a birth defect that caused lung disease, pancreatic disease, liver disease. And so we got rid of that one. We got rid of muscular dystrophy. And another one we didn't think about was Epidemic syndrome, SIDS. Mothers were supposed to be laying on the babies and smothering them. No, they were dying of hypertrophic cardiomyopathy heart disease, the same thing that are killing our young athletes today caused by deficiency of a single nutrient. And by 2015, a shocker to me, a surprise to me, I received this Lifetime Achievement Award because of these court cases and everything, getting rid of these 3 diseases. The United Nations awarded me, and in the back cover of It's All in Your Head, there I am at the headquarters of the United Nations in New York City receiving that award. I was just awestruck that I got the award from the United Nations. Okay, it's the Lifetime Achievement Awards in Natural Medicine. Lifetime Achievement Awards in Natural Medicine because of my work with cystic fibrosis, muscular dystrophy, and sudden death syndrome. And now we have this thing where the kids, the mothers, they're kind of hungry because the mothers don't know what to do for them. Well, get them on cow's milk and goat's milk and get the kids toddy. On the back label, it tells you how to dose it based on body weight. And it's a liquid multiple, tastes good, kids will love it. Put it in the goat's milk, put it in the cow's milk. Also, the cherry mins use the same weight dosing thing for the cherry mins. Don't forget the EFAs. Prevents blood clots, but also is very, very important for the lungs and oxygenation and skin and digestion and so forth. And also, everybody's got to stay away from gluten so they can absorb these nutrients. No wheat, no barley, rye, and oats. You got to live like an Asian. You heard me say this over and over and over and over. And when you look at a breakdown of these big cities, okay, and let's say the big city, their life expectancy is 75. And you break it down into the black part of the population of those big cities, their average life expectancies in the 60s, 61, 65, 63. You look at the whites and the Latinos, it says 75. But then you look at the Asians in those big cities, like New York and LA and stuff like that. And guess what? Their life expectancy is 89 to 91. Well, why are they living so long? Well, that's because they're not eating wheat, barley, rye, and oats, and they're eating seaweed with all those minerals from the ocean. And that's why we have fucoid Z and Z radical, okay? And that's why we say don't eat wheat, barley, rye, or oats. Give that up. If you have a 6-month supply of wheat, barley, rye, and oats in your cupboard because you thought, the supply chain was going to shut things off and you bought up all the wheat, barley, rye, and oats you could find, box it up and give it with love to your doctor. Don't you let anybody in your family eat any of that wheat, barley, rye, and oats. Give it to your doctor. It's kind of like to Russia with love. Okay, same principle here. It's one of those things where they made a horrible mistake when they were telling people to eat more whole grains, because now we have not only all these 25 diseases from osteoporosis of the skull, we also have MS, multiple sclerosis. We're spending $85 billion a year, $85 billion a year, $85 billion a year for just pharmaceuticals to treat symptoms for MS, multiple sclerosis, okay, which is a simple nutritional deficiency disease. And both multiple sclerosis and osteoporosis of the skull, both of them have a terrible gluten issue. Both of them have celiac disease as part of their big hoo-ha. They cannot absorb nutrients even if you're giving them to them. So they got to change their diets and live like an Asian and take the 90. And we have secret sauces for specific diseases and specific symptoms. And that's why we have all these books. Don't forget The Truth About Nutrition. And I'm not going to give away too much, but Pharmacist Keith and I are working on a CD set. Okay, it's going to have 10 CDs in it from over the years we've been working on this Zoom thing here, and he's gone through and picked out what he felt were the best ones. And so it's 10 different diseases, 10 different CDs, all in one set. Oh my gosh. And when do you predict we're going to have that out and available, Pharmacist Keith?
It's going to take me probably a week or so to get it all together.
Oh, okay. So by the time we get it packaged and printed and everything, we're looking at a month and a half, 2 months. It'll be available. I'm excited about that. And so this will be a joint project between Pharmacist Keith and myself. And it's going to be very exciting because just the information there, if you follow that information and use the longevity programs appropriate, as mentioned in this CD set, you can add 25 to 50 healthier years of your life and be like the Asians in these big cities. Okay. Be like the Asians in these big cities and live 10, 15, 20 years longer than everybody else. Okay. This is not difficult. Okay. To understand. Would you just take dirt from Texas or Saudi Arabia and put it in your oil pan in your car because there's bound to be some oil in it? No, an idiot wouldn't do that to their car. Well, what about putting some dirt from Saudi Arabia in your gas tank? There's bound to be some gasoline in there. An idiot wouldn't do that to their car. And so why would you take $85 billion worth of pharmaceuticals just to treat symptoms and 2, 3, 4, 5 years later die from the disease when you could have taken the 90 essential nutrients, gotten off the bad foods and had 25 to 50 healthy years of your life? Which choice do you want? I get excited about this, Pharmacist Keith, because we are going to save a lot of people.
Absolutely. I get really excited about this as well. And, you know, it's a message that's timely and we've got to get it out there to as many people as we can. And, you know, folks, it's something that you can do yourself. You can spread this message out there by just sharing these videos and sharing, you know, the information that is on the internet right now about Dr. Wallach. You know, I get a lot of people that think it's, you know, not fair that I get this time with Dr. Wallach to share with you guys. And you know, it's, you've got a disadvantage to your business because you don't have Dr. Wallach yourself. Here's what I want to say about that. I had a conversation with Tom Chenault about this the other day as well. What I do with Dr. Wallach is something that's not duplicatable. And it has actually hurt my business more than it's helped in the fact that, yes, I get a lot of customers, but because this isn't something that's duplicatable, a lot of them don't become associates. Where you guys have the opportunity to use these tools and, you know, not have to be an expert yourself. And that's more duplicatable. You know, you can tell people, oh, well, there was a video recently where Dr. Wallach talked about sudden infant death syndrome. He talked about the shortage of baby formula. You should watch that video. And you share that with them. You're not the expert. You're just sharing the information. And that's the way that 99.9% of the people in the world that have a home-based business like ours, that's the way they create their income, by just becoming the sharer of information.
Messenger. Yeah, the messenger.
Right, to be the messenger and to teach your family, say, you know, that's all I did. I just shared that with you. Can you do that? And that's so much easier than them looking at me and thinking, well, I can't be Pharmacist Keith. I can't make money in this business. I have to know all this information. Just become a messenger and share these videos. And like I said, that's a conversation I had recently with Tom. And yeah, when I joined Dr. Wallach in the beginning, yes, I hit the car bonus and the 1 star within 3 months of joining. But again, none of the people that I brought in over those years from that beginning effort, none of those people ever went on to become a 1 star. They shared a little bit of information, and some of them might have had a customer here or there, but it's the folks that don't have programs like this are the folks that are making the most money in their home-based business because they're doing a better job at being a messenger. And that's something I'm working on as well. This show I do once a week, I do for you guys. Okay. And that's all it is. I do this for you guys. I have a passion as a pharmacist to get the information out there. I want to get the information out there to as many people as I possibly can. And that's why I make this show available to you. If anybody has any questions today, raise your hand, or if you're on Facebook, type in the comment section.
Let's see, I have someone that said a gynecologist told her sister that she'll need to have a hysterectomy due to her having a large cyst on one of her ovaries and said her uterus is enlarged. What's a natural way to help her without the hysterectomy? I love that question, Dr. White, because it is
Isn't that a
something
beautiful one?
yeah, it is something that can be done.
For a cyst, he's going to do a whole hysterectomy. Oh my gosh. Okay.
Right.
And so basically what needs to be done, the very basics, start out is get rid of all the bad foods, no fried foods, no processed meats, no oils, no glutens, no wheat, no barley, rye, no oats, no sugar, no carbonated drinks. Even the diet ones need to go because the carbonation neutralizes stomach acid, which is important for absorbing minerals and digesting food. Then per 100 pounds of body weight, they need one healthy brain and heart pack per month that has 215 nutrients, the core of which is the 90, plus another 115 or 120, whatever it is. Okay. And that's going to give the body, including the uterus and ovaries, what they need to make the proper hormones. But there's a couple of things here we need to add to this. Number one, per 100 pounds of body weight, they need to eat 3 eggs twice a day. Okay, because estrogen is 95% by weight cholesterol. Testosterone in males is 95% by weight cholesterol. So don't get on a cholesterol restricted diet. Do not take statin drugs. Cholesterol is not what clogs your arteries. Salad dressings and cooking oils and fried foods are what blocks your arteries, not cholesterol. Cholesterol makes up 75% of your brain weight. And if you start restricting cholesterol, your body can make a little bit of it, but maybe not enough, especially if you're eating gluten. And one of the things that's a feature of MS, multiple sclerosis, is celiac disease, okay, which is gluten hurting the intestines. One of the features of osteoporosis of the skull is a celiac disease. Okay, so those two things are related because of that. And there's no reason why people don't have osteoporosis of the skull and MS at the same time. Okay, I see a lot of that. And so it's one of those things where you got to eat your eggs. And then, of course, if you're a female with a cyst in your uterus, in addition to those eggs, get that cholesterol, would also take the Zarafem. Per 100 pounds of body weight, I'd go ahead and take 3 twice a day, 3 at breakfast, 3 at dinner time. That'll be 2 bottles a month per 100 pounds of body weight. And that's going to help the ovaries make estrogen and progesterone. Okay. But don't forget, it does require the cholesterol to do that. Cholesterol is the raw material to make the hormones. And so this is not difficult. And of course, all this will be in this big set that Pharmacist Keith and I are working on. It's one of those things where I get very, very excited because we have the answers to this. It's just a matter of, are you going to deal with it? We know how to make a nice formula out of cow's milk and goat's milk and camel milk and llama milk, whatever kind of milk you're going to use. Don't forget the kid's toddy. And again, the dosage is on the back panel, back label. And of course, use that same dosage for body weight for your babies when it comes to the cherry mins. And then don't forget the EFAs. Just use one EFA, puncture the EFA. Don't puncture the kid. You puncture the EFA and squeeze it in to the formula. And it wouldn't hurt. You hear me, I tell parents they should do this. So even if they're breastfeeding the babies and they're taking the supplements, I like them to make one meal a day, either from formula or from cow's milk or from goat's milk, whatever, with the kids' toddy and the cherry mins and the EFAs in it. That way, if something like this happens, they're already used to taking the other one. Okay. And so my fears have come true here with the supply chain thing and for production issue. And so now there's going to be babies who are really, really in trouble because parents don't know what to do because the doctors are saying, don't try to do this yourself. Just sit there and wait until we can come up with a supply. Well, what if it's 2 months? What's the baby to do? Just drink water for 2 months and die of lack of calories and protein and vitamins and minerals? And so, no, we have a system that we've been doing forever. Okay, literally, because thousands of years ago, when mothers were busy doing things outside the home, they were feeding cow's milk and goat's milk and sheep's milk and llama milk and camel milk to their babies. Okay, and so it's one of those things where we know from history that worked. So why not continue to do that and make it available to our kids? And the kids will be happy and they'll applaud and give mom and grandma a big hug and a kiss because they are going to love their kids' toddy with the cherry mints and the EFAs in it. Over to you.
Absolutely. And I can vaguely remember from my younger days, I'm showing my age here, when formula didn't exist yet. I remember that the ladies would make formula from evaporated milk. And I can't remember Pet put it out, the evaporated milk company. And I saw recently the formula online, and I didn't save it. I should have saved it. But it's been going around online because of the formula shortage, how to make your own. The one thing I did notice in their recipe was the lack of supplements being added to it. So if you find the recipe online for using evaporated milk to make baby formula, make sure you are putting into that formula that you make the kids toddy and the EFAs. I prefer the omega-3, but either one's fine. And so you got and the cherry mints. In fact, use the unflavored ones, and it doesn't alter the flavor of the product there. I was just looking. An article came in my email. I get all kinds of articles because I'm a pharmacist. But apparently, the European Congress on Obesity met recently, and here's some of the headlines that were coming out of that conference. Obesity may weaken COVID vaccine protection in the never infected group. Vegan diets do help shed pounds, but it doesn't put a dent on diabetes. There's an article talking about the critical window to intervene for weight issues in our early childhood. And yes, so you do have a critical window there. If you can get it under control early, that's going to save the child from a lifetime of various comorbidities. Another one says obesity epidemic in Europe. 1 in 4 teens don't even know they're obese. There's a greater risk of fatal prostate cancer in men that are obese. And it says calorie counting and exercise are of limited value for obesity weight loss. And Dr. White talks about that all the time. It's because they're overlooking all these diets. Every diet that's out there is overlooking the nutrition component of it. So it's overlooking the fact that we're deficient of the minerals. I did a video a long time ago called why diets fail. And that's one of the things I highlighted in that is all these different diets, they have their good points, they have their bad points, but every single one of them totally ignores the mineral deficiency side of it, which leads to what the veterinarians call the cribbing. I've shown you guys the picture of the horse many times on here where they've just chewed the heck out of the top of that fence rail. And I guarantee you, if you go to a thoroughbred farm in Kentucky, you're not going to see that, because those horses are treated properly and they're getting all the nutrients they can. And that should be another hint. If these $1 million race horses are having less disease than the regular horses that aren't getting as many of the nutrients, that should be a hint that there's a component here to that. And the same thing in obesity, same thing in weight loss. I mean, if your favorite diet is Weight Watchers, fine, do the Weight Watchers diet, but make sure you're taking the cherry mints several times a day while you're on that diet. If your favorite diet is Dr. Atkins, fine, do that. Whatever that diet is that's your favorite diet, make sure you're adding all 90 essential nutrients to that diet, and especially the minerals. 90 for life.
Exactly. You get an A+ there, for instance, Keith, because when you have a mineral deficiency, you develop a behavior called pica, P-I-C-A. In animals, it's called cribbing, as you pointed out. And why do they call it cribbing? Because babies, when they're deficient nutrients, they will chew on that top rail of the crib. And so it's called cribbing. That's where that term cribbing came from.
Yeah, and that's where the concern with lead poisoning in the babies, because they would chew on the window sills and so forth. And they're getting all that lead from the old paint. So it's just amazing to me how the medical system completely ignores all this, because it's too simple of a fix, and it's not going to earn billions of dollars. I
was going to say they don't get any
prescription
income
drugs
from sharing that information. Yeah,
right.
All right, Lady Knight, you have a question. Go ahead and unmute yourself.
Thank you so much. Dr. Wallach and Pharmacist Keith, I want to tell you, thank you so much for having this call. It has been so important to me, my family, my friends, my clients, even my pastor. There's been such great response and due to these calls and the protocols that you recommend. And because of this, this call, it has helped me to earn, to become a 1-star by promoting these products. And Dr. Wallach, I'm also recommending to all of my clients that they also purchase the plant-derived minerals. Thank you so much for this call. We really appreciate it. We really, really do. Thank you, Pharmacist Keith. Thank you so much.
Well, Lady
You're an
Knight,
angel of God. Yeah.
yeah, that's exactly what I'm talking about. You're doing what I tell everybody that I meet that wants to create some income in this business to do. Just become the director, become the tour guide to show people where to go to get the information and then solve their problems that way. We do really appreciate it. And that's why we do this every week. Okay, question on how much Sherry means to give to 18-month-old. It depends on the weight. An ounce is for 100 pounds. So
1/5 of an ounce.
Yeah, 23 pounds. So you're going to give them a teaspoon on 23 pounds. That's what I gave mine. But anyway.
Half a teaspoon twice a day. Okay, perfect.
I don't know, Lady Knight, if you had another question or not, your hand's still raised. Christine, go ahead and unmute yourself.
Good morning, Dr. Wallach and Pharmacist Keith.
Hi.
Yes, my question is in reference to something minor, but 68-year-old woman fell and scraped the front of her leg and broke the skin. And so she cleaned it and put some Trinity lotion on it. But a day later, it's kind of like redness around that area. And so she cleaned it again and put the triple antibiotic on it, something like Neosporin type thing. Still has some redness and trying to minimize the scarring. So should she try the minerals on it and colloidal silver, or what would you recommend for healing of a scrape wound? That's
okay.
Redness.
Well, she needs to get rid of the bad foods. Okay, no fried foods, no processed meats, no oils, no glutens, no wheat, bran, oats, no sugar, no carbonated drinks. Even the diet one's got to go. Per 100 pounds of body weight, she needs the 90 essential nutrients, right? Per 100 pounds of body weight.
Yes.
She'll need one to go with one healthy branded heart pack per month. And then topically on the wound, that colloidal silver will kill just about every bug you can name. Okay. And it doesn't burn. There's no alcohol in it. You can put it in a baby's eyes. It's so safe. It's one of those things where, I know people that get all kinds of burns and stuff like that in their skin. They get ulcers on the skin because of the burns. And they put the colloidal silver on it. It might take a couple of weeks or a month to heal, but they don't have to worry about getting antibiotics, which will maybe screw up the metabolism of the entire body. Okay. Or they can just use the colloidal silver topically 2, 3, 4 times a day on that open wound. And take the healthy branded heart pack, take the MSM, take the collagen peptides, take the vitamin D3, the Beyond OsteoFX, and the skin will heal very quickly with all that. Don't forget hair, skin, and nails. That's also another thing you can add to it. If it happens in a place where there's hair, okay. This is not difficult. The body has all the equipment. The good Lord provided us with all this machinery. Which just requires a little bit of effort on our part to give the machinery what it needs to do its job.
Right.
Okay. Okay.
Should she use the minerals topically too, or just that colloidal silver?
Well, she could do both. It doesn't hurt to use the colloidal minerals topically, but the colloidal silver specifically kills bugs. The colloidal silver, you're giving the local wound the raw materials to kind of rebuild the connective tissue, which is a major, probably 2/3 of the thickness of the skin is connective tissue.
Right. Okay. And discontinue the antibiotic ointment if you are using the colloidal silver.
The antibiotic ointment's fine too. I mean,
So,
you could do,
for me,
both.
I would use both. I mean, that's putting my pharmacist hat on. More is better than none.
There you go.
And just something I want to say about colloidal silver, in severe burn patients, I don't know if you guys are aware of it, there actually is a prescription product that combines silver and sulfa, and they use it in burn patients. So silver is well known for its healing capacity, and it's well known in the medical community as well. That's something that goes back eons. I probably, when they first discovered silver, is probably how far back it goes.
Yeah, thousands of years.
Thank you so much.
Mm-hmm.
Okay, let me check over on the Facebook side. Folks on Facebook, if you ever want to get on the call live to ask your questions, then just go to zoom.campaignfornutrition.com, zoom.campaignfornutrition.com, and we'll connect you up live. All right, anyone else have any questions? I don't see any hands raised at the moment.
Well, I can ask another one. We got
Sure,
time.
if you got another one, go ahead.
Yes, I did hear of, but I was trying to wait till I got more information, but I just heard that this older lady at my church had a mild stroke. And so kind of like wanted to know what to share with her in reference to that,
Okay.
I'm trying to think how much she weighs, maybe 140 pounds, maybe.
Okay. So let's just say that she's 140 pounds. And a stroke is a blood clot, in a vein or an artery of the brain. Okay. And it's one of those things where you have to get down to the basics. None of the fried foods, processed meats, oils, glutens, wheat, butter, rye, oats, sugar, no carbonated drinks. And when I say no gluten, we mean no wheat, no barley, rye, no oats. There are no such things as gluten-free oats. The oats gluten is called gliadin. It's still gluten. Okay. And then 140 pounds with a stroke, I would go with 2 healthy brain and heart packs per month, 2 healthy brain and heart packs per month, full dose everything twice a day. I would also have her take 2 bottles a month of our Ultimate Daily Classic tablets. They're designed to support and promote healthy blood flow through blocked arteries and support healthy blood pressure. And that's a perfect supplement to the 90, or actually the 215 when you're doing the Healthy Brain and Heart Pack, the Healthy Brain, the Ultimate Daily Classic tablets. And if she weighs more than that, she could take 3 times a day. For prevention, I take 3 twice a day of the Ultimate Daily Classic tablets. Been doing that for as long as we've had them, for over 25 years. Help people who have high blood pressure. It'll help people who are on dialysis. They can usually within weeks or months get off of dialysis if they use the Ultimate Daily Classic tablets. And the doctors say, I don't know why, but we can reduce your dialysis from 6 days a week down to 3 days a week. And after a couple of more weeks, I don't know why, but you don't need dialysis anymore. Okay, well, that's because you're taking the Ultimate Daily Classic tablets and you're repairing the walls of the arteries and preventing the blood clots and that kind of stuff. And so, again, we've been doing this. We're in 80 countries. We do this thousands and thousands of times a day all over the world. So we have an enormous amount of feedback. And I can't wait for this new project that Pharmacist Keith is finishing up. It's going to be a big one. It's going to help millions of people all over the world. I'm very, very excited about this new tool coming out. And so, we're looking at, I'll get to see the finished product here in a couple of weeks. And then when he and I are both satisfied with it, we'll start putting it together, and it'll be available to everybody. And it's going to be something that's, I wish I say, very, very affordable. It's not going to be $500 for one of these sets or anything like that. Okay. It's going to be affordable. And obviously, like when you look at my our list on our book list, if you buy 10 books of any particular one title, you get a big discount. And so we'll have discounts on this new tool too. If you buy one, this is the price. But if you buy 10, you get a discount on each one. Okay, so the price is a little bit lower, so you can sell them at the regular price to people in your group or your family. Make a little bit of money. That'll help you, encourage you to buy 10 instead of just buying one. And so, all these things we've learned over the years is going to be put into this project, and it's going to be a big one. This is going to help millions of people all over the world, and so I'm very, very excited about it. It's going to save a lot of money. And my goal right now is to eliminate the disease called MS, multiple sclerosis, because we're spending through just insurance payments alone, for pharmaceuticals each year in America. $85 billion. I freaked out when I saw that. That came out about 3 weeks ago now, or 3 or 4 weeks ago. $85 billion just for pharmaceutical costs. That doesn't count lab tests. It doesn't count doctor's fees. It doesn't count hospitalizations. It doesn't count any surgeries. It doesn't count any of that kind of stuff. $85 billion just for pharmaceuticals to relieve symptoms. Now, this is a terrible, 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 which I say thing when you look at it, because MS, multiple sclerosis, is not a disease of autoimmune disease where your body's attacking itself like doctors believe. Okay, and when you look at it, just like osteoporosis of the skull, everyone with MS, multiple sclerosis, also has celiac disease. All of them have a gluten issue, and I would say that there's a lot of overlap between osteoporosis of the skull and MS, and so we're working on that. When we have somebody with osteoporosis of the skull, we're going to treat them for osteoporosis of the skull and MS. When people have MS, we're going to treat them for osteoporosis of the skull and MS, and we're going to get a result that is going to blow everybody's minds. And so I'm very, very excited about this whole thing. Over to you, Pharmacist Keith.
Okay, and I forgot, she does have diabetes. The lady that I was asking about had the mild stroke. So how many sweeties would you, for 140 pounds?
For 140 pounds, I would have her take 3 sweeties twice a day, and don't cold turkey off her medication. But as her blood sugar improves, she can slowly reduce the medication based on the numbers. It usually takes anywhere, I would say, give me 90 days, but usually you don't need that. Usually within 4 to 6 weeks, they're totally off their medication. If they're doing everything correctly and staying away from all the bad foods. And that means everybody in the household, so there's no cross-contamination and the food preparation surfaces in the kitchen and the laundry and all that kind of stuff, the couches, the beds, the rugs. The transmission, excuse me, of gluten dust is very easy. So cross-contamination from other people in the household, at work, or if you wash your clothes in the laundry and the laundromat, guess what? You're getting cross-contaminated because everybody there is eating gluten.
Right. Now with that second dose of sweeties, is that like at dinner or bedtime?
The 2 largest meals.
Okay.
Yeah, breakfast and dinner.
Thank you.
All right, we have a person has a question about arthritis. If you can unmute your phone, so Dr. Wallach can ask you some questions.
Hello.
Okay. They may not be able to unmute. So in general, for arthritis, I love this one because this is the one that the very first time you came to Kentucky, that might have been the second time, for a show for me. I remember it was in January of 2013. We had a massive ice storm. Remember that, Dr. Wallach? We really considered canceling, but this group showed up. They were Mennonites. So, they were dressed just like, your Amish and so forth, but they had driven all the way from Alabama to Louisville in order to be there to ask this very question of you. One of the gentlemen in their group was about 40 years old. He had severe degenerative disc disease to the point that his doctors had maxed out all the opioids they could give him for pain, and basically had told him that his career was over. He's never going to work again. And he's going to be taking the opioids the rest of his life because there was nothing they can do short of fusing his entire spine. And when this gentleman was there, you were very blunt about it, that give you 90 days. And what do you got to lose? You're already to the point where you feel like there's no return. So give you 90 days following the bone and joint program. So can you give us that bone and joint program for arthritis and degenerative disc disease and all the other related diseases?
Osteoporosis of the skull and peripheral neuropathies and receding gums and loose teeth and all that kind of stuff. Yep, all the same thing. So none of the bad foods to can maximize absorption. No fried foods, no processed meats, no oils, no glutens, no wheat, no rye oats, no sugar. Even the diet ones got to go. And then per 100 pounds of body weight, 1 healthy brain and heart pack per month. 1 healthy brain and heart pack per month. I'd also throw in 2 bottles a month of the MSM. So you can take 3 at breakfast, 3 at lunch, 3 at dinner time. they're going to support and promote maintenance repair of cartilage, ligaments, tendons, connective tissue, disc between a vertebrae, bone, makes your bone itself. Then they need the collagen peptides, a scoop of that in breakfast drink, a scoop of that in the evening drink. Then they need the Beyond OsteoFX. If you're going to drink the liquid, take an ounce at breakfast, ounce at dinner time. That's 2 quarts a month. If they're going to take the capsules, I like 3 to 5 capsules twice a day. I also put a scoop of the Beyond OsteoFX in my drink in the morning, and a scoop in the Beyond OsteoFX of the powder in my dinner drink. Okay. And then also the glucogel. Get the large bottle of glucogel, so you can take 3 of those twice a day for 100 pounds of body weight. And you can regrow cartilage and ligaments and tendons and connective tissue. Oh, don't forget vitamin D3, 3 of those twice a day for 100 pounds of body weight, 2 bottles a month. Even if you live in Florida, okay, or Louisiana or Texas or Arizona, because adults, when they're outside watching their kids take their shirts off and run around out in the sun, the adults are sitting in the shade. And so that's why, and of course, women, they have 4 times the osteoporosis and arthritis rate as men, 4 times more than men. Is that a gender issue? No. Okay, it's an environmental dietary thing. Because women, well, men are outside with their shirts off, dealing in the fields and washing cars and all that kind of stuff. Women are in the house snapping beans and washing clothes and ironing clothes and stuff like that on the inside and not getting that sunshine. And they don't want wrinkles on their skin. So when they're outside, they're sitting in the shade and having big, broad brimmed hats and all that kind of stuff to shade their face and their necks and chests and arms and so forth. And so this is why there's this huge difference. Same way with MS. Women have 3 times the MS as men, and women have 4 times the osteoporosis as men. It's all environmental and dietary. And so we can fix that, okay? And doctors just give the statistic and say, okay, well, women are a great source of income because we know they have 4 times the osteoporosis as men. We do all these double hip replacements, double knee replacements, back surgeries, neck surgeries, shoulder surgeries, finger surgeries, toe surgeries. Okay. And this is the way doctors look at it. No, we can prevent all that. We can reverse all that. And so it's just a matter of paying attention to the details. And all this new project is coming out that pharmacist Keith and I are working on. Oh my gosh.
I'm going to share something to the screen right now. It's a little chart about mineral deficiency symptoms and which minerals are causing these symptoms. Remember, these are red warning lights. It's a red warning light when you have a symptom that something's wrong in the body. And for the vast majority of us, it's mineral deficiencies. And you're not just deficient of one mineral. You're deficient of many minerals when you have the deficiency. It just so happens that your body responds to one mineral deficiency before the other, and your neighbor has completely different response to it. But like cramps is caused by calcium and sodium deficiency, depression, calcium and sodium, diabetes, chromium and vanadium and zinc, digestive problems, chlorine, chromium, zinc, eczema, zinc deficiency, goiter, iodine and copper deficiency, hair loss, copper and zinc deficiency, graying hair, copper deficiency, hyperacidity, chromium, zinc, magnesium, and lithium, weak immune system, zinc and selenium and chromium. I can keep going on there, but you can see that all these different symptoms have similar deficiencies. So, just because you're having one symptom doesn't mean you're going to end up with deficiency in other areas as well and eventually have these other problems. That's why the metabolic syndrome is such big in the medical news now, because the doctors have realized that when you have one of these diseases, at some point you're more likely than not going to get one of the other diseases in that syndrome. And that's why they call it a syndrome, because they're saying, I don't know why, but for some reason, if you've got diabetes, you're most likely going to be obese. You're most likely going to have a heart problem. But I don't know why. We just know that happens. So we're going to give you a prescription drug for each of these things. which then causes more problems for you to where you're going to be on more prescription drugs. And eventually you're going to end up in a long-term care facility like I work for on, 20, 30, sometimes even 40 different prescriptions. And your quality of health is going to be miserable.
Now you're talking about one person getting 25, 30 prescriptions.
Oh, absolutely. Absolutely. By the time they get to long-term care. And, I look at it, and it's because, I'm in a position where there's nothing I can do about it. I'm on the back end of this whole thing. And I just look down the list. And it's like, if they had just taken care of this, these other things wouldn't have happened. They just took care of this, these other things wouldn't happen.
Yeah.
And, that's what makes me so passionate about what I do here.
Well, that's why I ask about when I ask people, do you have white, gray, or silver hair? When I'm talking to them on the radio, they say, well, yeah. Okay, you can tell, well, why are you asking me that? Okay. Well, because when you have white, gray, or silver hair, whether it's in your beard, your mustache, your head hair, or your body hair anywhere, it has nothing to do with aging. I'll repeat that. It has nothing to do with aging. It's also a nutritional deficiency, as Pharmacist Keith points out. That same nutritional deficiency that causes white, gray, or silver hair causes all kinds of other problems in the body. And so it saves a lot of laboratory fees. It saves a lot of time, because I know the answer when I ask, and you say, oh yeah, I've had gray hair for 20 years. You see a kid who's 12 years old with white hair, they have a terrible deficiency of those nutrients, because it's not an aging thing, it's a nutritional deficiency thing.
Yeah. Graying hair is a deficiency of copper. You have goiter. I'm just looking down the list here.
Oh, you can
arthritis,
get aneurysms,
birth defects, cardiovascular disease. That's just the few on this list that are related just to the gray hair. And you wouldn't think those things would have anything to do with each other. If you add to that hair loss, that adds in there also zinc. Then you got digestive problems, eczema, hyperacidity, weak immune system, impotence, acne, asthma, brittle nails, birth defects, cardiovascular disease, chronic fatigue syndrome. So you can see how all these things add up. And that's why we're always very adamant that you want to make sure you cover all your bases and you get all 90 essential nutrients. If you can't afford all 90 essential nutrients, at least get the minerals, get the liquid minerals, because the vast majority of diseases are caused because of mineral deficiencies. Minerals are the driver of your health. Your body cannot operate with these minerals. If you go back to your high school chemistry days, minerals were the component that you would add to chemical reaction to get it to go one way or the other. If you had too much of it, it might go too far. If you have too little of it, you don't get the reaction you want. So the mineral is the driving force in every chemical reaction in your body. And some of the chemical reactions, the body substitutes other minerals for, and that's why it takes longer for the deficiency to show up. But eventually it breaks down, because eventually you run out of all of the nutrients that you need. And that's when you end up in long-term care facilities. I'm seeing people now in their 50s that are in these long-term care facilities.
Mm-hmm.
So, and it's because of a lifetime of deficiency. And, it has to do with everything in the processing of our foods, the gardening, the growing of our foods. I mean, it's the entire cascade of issues. Lady Knight, did you have another question?
I do. I have a male client that's 60 years old. He's 6'2". He weighs 170 pounds. He's not a diabetic, but he does have high blood pressure. A heavy piece of metal fell on his head at work a year or so ago, and he had to retire due to some neck injury. And now he's experiencing some numbness and weakness in his left arm and fingers. He's having dizzy spells, and he does not sleep well due to that injury on his neck and shoulder. Do we have recommendations for him, please?
Of course. Okay. Yeah. Again, none of the bad foods, no fried foods, no processed meats, no oils, no glutens, no wheat, no barley, no sugar, no carbonated drinks. Even the diet one's got to go. Now, 170 pounds, I'd give him 2 healthy brain and heart packs per month, a full dose of everything twice a day. He also needs 2 bottles a month of the MSM, so he can take 3 with breakfast, 3 with lunch, 3 dinner time. And they're going to support and promote maintenance repair of cartilage, ligaments, tendons, connective tissue, discs between a vertebrae, bone itself, He also needs the collagen peptides, a scoop of that in his breakfast drink in the morning, a scoop of that in his evening drink in the evening. And then he needs vitamin D3, 3 of those twice a day. And he needs the, I'd go ahead and give him also the Beyond Osteo FX, 2 servings of that a day, whether it's the liquid, the capsules, or the powder. I like the powder. I put a scoop of that powder in my morning drink and a scoop of the powder in my evening drink of the Beyond Osteo FX. And then also I would have him take, let's see here. Let's vitamin D3. Don't forget the vitamin D3, 3 of those twice a day, 2 bottles a month. And let's start there. And he has high blood pressure also.
Yes, he does.
Okay, then he needs 2 bottles a month of the Ultimate Daily Classic tablets. Take 3 at breakfast, 3 at dinner time. And don't cold turkey off his high blood pressure medication. But as the blood pressure drops, he can slowly reduce the medication based on the numbers. And usually it takes about 2 to 6 weeks to get off the medication and be free of high blood pressure. But he's got to stay on all this program, okay? Just like oxygen, you need it forever. You need water forever. You need these 90 essential nutrients forever. And so it's one of those things where if he stops taking all these things when he feels better, within a month or 2, some of them will start coming back. And getting out of that hole the second time is more expensive and could even be deadly. And so you don't want to ever quit. Once you are having the good success, you stick with it. Okay. And that way you won't have any problems.
And for his pain and lack of sleeping, is there anything?
Well, if he has pain, okay, we do have topical pain relievers. Okay. We have the Soothe from our Hemp FX division. We actually have a roll-on. Okay, we have a roll-on now from the Hemp FX. Okay, then we also have the CM cream and trauma oil he could put on his neck or his shoulder or his wrist or wherever he has pain. But that won't take long. After a couple of weeks or a month or so on this program, he won't need the pain relievers.
Now, I recommend take that Hemp FX Soothe and add the trauma oil, a few drops of trauma oil to it as you're putting it on.
Yeah, you can get 4 hours of pain relief for that one.
Will it also address the numbness and the weakness? That'll be addressed as well on this protocol.
Well, this protocol will address the numbness and weakness, because when you have numbness, that means that the nerves are being squeezed.
Oh,
Right.
thank
Yeah,
you.
so the nerves coming out of his neck are what's going down his arms, and that's what's causing the numbness there. And with that neck injury,
and did he get hit? Did he get hit in the neck? Did he get hit in the head?
It fell on his head right at the back base of his neck, right at the base.
Yeah, and so he could have a combination of just that trauma as well as osteoporosis of the skull.
Okay, thank you so much.
And check with the chiropractor as well for techniques to use to relieve some of the pinching there that can be used temporarily while this products work. There are some traction devices and so forth that can be used to help pull the neck apart a little bit and give some relief.
Thank you.
Okay, thank you.
All right, Dr. Wallach, it is now that time of day. We're at the top of the hour. So can you tell us how folks can get hold of you on the radio?
Okay, well, let's see, Pacific time, noon to 1. That's Dead Doctors Don't Lie. You can call me toll free at 888. That's 1-888-379-2552. That's 1-888-379-2552. Again, that's from noon to 1. And from 1 to 2 Pacific time, it's Let's Play Doctor. It's 1-877-912-PLAY. That's 1-877-912-7529. And I've been doing those 2 shows for over 30 years. And so we have a huge, huge following. So don't wait in the middle to call me. If you want to get on, you have to call like 5 or 10 minutes beforehand. And that way you'll have a space. Okay, but it's toll free. And if you want to get books and CDs and DVDs, you can get a hold of me at www.drjwallach.com, www.drjwallach.com. And if you buy 10 of any of the titles, you get a big discount on that title. Okay, if you buy 10 or more.
So You can get hold of Dr. Wallach on the radio Monday through Friday, weekdays, 3 to 4 p.m. Eastern. Dead Doctors Don't Lie, 888-379-2552. That's 888-379-2552. You catch the archives of that particular show at radio.givedoc90days.com. That's radio.givedoc90days.com. Doc, I want to use my radio voice when I'm talking about this.
Oh, yeah.
And then weekdays from 4 to 5 p.m. Eastern Time, you've got Let's Play Doctor, 877-912-7529. That's 877-912-7529. And don't forget, folks, Dr. Wallach's videos, DVDs, CDs, cassettes, books can all be purchased at drjwallach.com. That's drjwallach.com. And I encourage you to go directly to the source to buy these. Dr. Wallach's entire income comes from the sale of his books and CDs. You can find some of the titles on Amazon, but then the cost is being shared with Amazon. So why do we want to give Amazon more money than we have to? Buy directly from Dr. Wallach and cut out the middleman there. drjwallach.com, drjwallach.com. And be sure to get this book here, this set here. It's called The Truth About Nutrition. It's a little bit of Dr. Wallach's story and a whole lot more in there. You get the book, the CD, and the DVD in this package. That's The Truth About Nutrition. That's an excellent, well done, professionally made video there that comes with that. It's not something that was recorded at some meeting or so forth, or a Zoom call or that type thing. That's an actual professionally studio made recording, and it's a very good product to have. Something that's really nice to be able to share with your friends. There's a book, the CD, and the DVD all in that package. And you can get that again at drjwallach.com. Dr. Wallach, I guess we'll see you again next week.
Absolutely. And we'll probably see you between now and then because we got lots of stuff going on here. God bless you. Thank you for all the great work you do, and see you soon.
I'll talk to you soon as well. And folks, just want to remind you that you get 2 free gifts for being a participant in our program. If you go to dddlvideo.com, that stands for Dead Doctors Don't Lie. It's dddlvideo.com. You'll get a copy of the report that Dr. Wallach did many years ago called Why So Many Young Athletes Die. This is a little article that he wrote talking about the mineral deficiencies and deaths of various professional athletes and young athletes. And it's a nice little handout to give to people, especially this time of year. I recommend printing that out, put your contact information on there, and then share it with as many people as you can, especially your friends and family that are involved in athletics during the summertime. Any friends or family that you have that has a job that a contractor or a roofer, or anything where they're outdoors and they sweat all the time. That's a report that you can share with them and recommend to them to get a bottle of the Cherrymans or the strawberry kiwi mins, and just teach them that they need to replace their all the sweat that they're doing, not with just plain water, because when you sweat, you're sweating out all the 90 essential nutrients. So you want to replace that with at least the Cherrymans or the strawberry minerals. I would take it one step further and get all these folks on the Rebound FX, because that gives some additional vitamins and nutrients in there, in addition to all the minerals. So that's a nice little tool that you have available to you. It's a nice little arrow to put into your quiver of different things to have available. Also, there is a video there that you can share. You can share the link for it. It's called Dead Doctors Don't Lie. Someone Should Go to Jail. Health, Lies, and Medicine. It's a nice DVD Dr. Wallach did many years ago. It goes into, it's basically an updated version of the Dead Doctors Don't Lie. And that's something that you can share with people as well. It's completely free. The link is dddlvideo.com. We don't ask for any contact information or anything on that. We're not, it's not a lead capture program where you're going to be put into a spam list or spam text. It's totally free for you guys to use and to share with your friends and family. And as always, I ask people that this program is copyright. It's copyright by Abell International,
Joseph Keith Abell. All the information in these videos and CDs that I put together are copyright. All the different sources where I put them online, there are copyright. So I do encourage you to, you're free to share them. Just don't copy them and reproduce them yourself. Again, free to share. I don't care who you give it to as far as sharing the links. That's totally up to you. Just be sure when you share the links that you tell the people to get back in touch with you, not with me, after they watch the video. And better yet, set up a time to get back with those folks after they watch the video and discuss what was learned on the video. Again, I do appreciate everything you guys do. I'm going to play a short video now as we leave. This video is entitled Why Pharmacist Keith Chose 90 for Life. So give me just a second. I'll get that started. And it's about 15 minutes long, but it's all about why I chose 90 for life. And it's something else you'd be able to share with your friends and family as well. So here we go. Hello. First of all, I want to thank you for taking the time to watch this video. I know your time's valuable and there's a lot of other things you could be doing right now, so I'll keep this as short as I can. For those of you that don't know me, I'm Keith Abell. I'm a licensed pharmacist and I've been an active pharmacist since 1995. I've worked in many practice settings over the years, but there's one area that I'm particularly passionate about, and that's what I want to share with you in this presentation. As a pharmacist, I'm very passionate about health and wellness. My goal is to help folks improve their overall health and well-being, and I probably take a little bit different approach to health and wellness than many of my peers do. Although the body has very complex biological processes involved in the disease process, I believe that our bodies were divinely designed to repair themselves, and given the proper tools, what I call 90 for life, and the proper environment, it can be accomplished. Yes, pharmaceuticals play an important role in human health. However, it's my belief that they should play a temporary role in the relief of symptoms. And our ultimate goal should be to find ways to allow the body's natural, God-given biological processes to take over. That is, to support and promote the body's ability to repair itself. Since I began my studies in pharmacy at the University of Kentucky, I've always been interested in the role nutrition and supplementation can play in disease prevention and improvement. Back in 1994, prior to graduation as a pharmacist, I started one of the first information and e-commerce websites on the internet. I provided free, helpful information on the use of herbs, vitamins, minerals, amino acids, and other nutrients for the treatment and management of diseases. I also offered quality products that weren't available locally to meet those needs. Upon graduation, most of my professional continuing education has focused on what Linus Pauling calls orthomolecular nutrition. That's the study of nutrition at the molecular level and how it can be used to alleviate symptoms of disease and improve the quality of life. Now, sometimes around 2004 or 2005, something happened in my practice that's had a profound change on the direction of my career. I had a patient come into my store and ask me a question regarding a nutraceutical that I didn't have the answer to. You see, I had a client come in to me and say that they had heard that fish oil lowered cholesterol and he wanted to know how much he should take. Well, that information wasn't available anywhere in any of my reference books, so I had to tell him that I'd get back with him after I do some research. I did a search of the available medical and scientific literature that was available at the time, and I found an article after article after article on all the great things that omega-3 fish oil did. You know, reduced blood pressure, improved cholesterol control, it improved control of diabetes, reduced inflammation and arthritis, it raised the good cholesterol, lowered the bad cholesterol. Study after study showing some positive impacts from omega-3s. Then I came across an article from one of the leading medical journals that said fish oil did nothing. Well, back in pharmacy school, I had a professor that said that when you do a scientific search in the literature and you come across many articles that had one result and then one article that had the opposite result, that we needed to ask three questions. Who funded the research? What did they stand to gain or lose from the results? And what did they do differently to get the results that they got? So I took a closer look at that single article that said fish oil did nothing, and I found that it was funded by one of the statin drug manufacturers. So that made it easy to determine what they would stand to gain or lose. If the results showed that it helped control cholesterol, then they would stand to lose billions of dollars in drug sales. So the next question was to look at what it was that they did different to get the results that they got. So then I looked at all the other studies that showed positive results, and in every single case, in all those other studies, they gave the participants anywhere from 6 grams to even 9 grams of omega-3 fatty acids per day. Then I looked at the statin company study. They only gave the study participants 1 gram of omega-3 per day. They knew it would fail before the research even started. This opened my eyes. Since that day, every time another study came out that said some nutraceutical did nothing, I would do a search of the literature, and in every single case, the negative study was funded by some big pharmaceutical company, and in every single case, they gave the patient a dose that was far below what the other research showed was effective. That's what we called subtherapeutic dose. Or they gave a dosage form that wasn't absorbed properly, or they gave a chemical version of the nutraceutical that wasn't the form that the body could utilize. You see, big pharma can't patent something that occurs in nature already, so they couldn't profit from positive outcomes. Eventually, big pharma couldn't ignore the evidence on omega-3 fish oils, so they came up with a synthetic form of it to take along with their statin drugs to gain better control of cholesterol and triglycerides. The thing is, even in the synthetic form, they say that it doesn't work alone. It had to be taken with their drug. It doesn't work because, once again, they still only tested it at 4 grams per day. Just to illustrate this one more time, I came across a recent article that said St. John's wort. St. John's wort's a medical herb that's been used for centuries for the treatment of depression. In fact, in Europe, it's the first-line treatment before they ever prescribe Prozac or any of the other prescription medications. Anyway, the article said that St. John's wort didn't work. So I pulled the article, and in the study, they gave the St. John's wort for 7 days and declared that it failed to work. Now, why is this significant? St. John's wort, just like the prescription drugs Prozac, takes time to accumulate in the body in order to become effective. According to the Natural Medicine's Comprehensive Database, St. John's wort needs to be given for 6 to 8 weeks to produce the desired outcome. Once again, Big Pharma produced a study with misleading information, then they published it in a national journal, knowing good and well that very few health professionals would ever pull the article out and look at what they did to get their results. By the way, that client that mentioned earlier that asked me how much fish oil to take, I had him purchase some high-quality omega-3 fatty acids and instructed him to take 3 capsules twice a day. That's 6,000 milligrams a day. Within the first month when he came in to buy another bottle, he told me that his joint aches had gone away. Some months later, he told me that his doctor had taken him off his statin medications. His cholesterol and triglyceride levels were in control, and his doctor even reduced the dose of diabetic medications that he'd been taking because he had gained better control of his blood sugar. This incident really opened my eyes, and over the next decade, I've immersed myself in learning everything I can about nutrition and supplementation and the role that it plays in our overall health and well-being. In 2007, I came across the research of a doctor that was a veterinarian, a pathologist, a biomedical researcher, and a physician, Dr. Wallach, that he'd been using veterinary nutritional concepts, that is, using nutritional supplements to prevent and reverse diseases in animals. He had been using these concepts on his human patients and had seen amazing results. I started using those concepts with my clients, using the formulations that were available to me in my store, and slowly but surely I began seeing the same results in my clients that he had seen. That's when I decided to try his product line for myself and for my family. My mother-in-law had, at that time, just had her second bypass surgery. Blood thinners and all the medications that she was taking were causing her to have a really poor quality of life. She always felt run down with no energy and was embarrassed about all the bruising that the blood thinners was causing on her arms. I tracked Dr. Wallach down and I spoke with him on the phone. I put my mother-in-law on Dr. Wallach's 90 for Life program for heart and circulation health. And with the help of her general practitioner, I weaned her off the blood thinners first. Then one by one, all the other medications. Now, a decade later, she still does not take any prescription medications for her heart or her circulation. She goes to her cardiologist once each year, has the ultrasounds done of her arteries, and every year since she started taking Dr. Wallach's products, her cardiologist tells her that she has no further blockage. He writes her yearly prescriptions for what he thinks she's still taking and tells her there's no need to change any of her medications to keep doing what she's been doing. She comes home, throws the prescriptions in the garbage, and continues, as her cardiologist told her, to keep doing what she's been doing. She continues to follow Dr. Wallach's recommendations and continues to take his products. She hasn't told the cardiologist about Dr. Wallach because she wants him to continue to monitor things on a yearly basis, and she's afraid that if she really let him know what she was doing, he wouldn't let her come back to his practice. Well, in 2013, I had the opportunity to meet Dr. Wallach in person and to work side by side with him throughout that year. About once a month, I'd travel with him all over the country as he did his health lectures, and eventually doing some of the lectures myself. I'd meet the folks that he had helped, that had been helped with his 90 for Life program, and were so grateful for what Dr. Wallach had done for him. With Dr. Wallach's guidance, I began working with folks that I met along the way, educating them on the necessity of supplementing with the body with all the 90 essential nutrients that the body needs to support and promote its natural process of repair. I started those folks on Dr. Wallach's nutritional products based on their individual needs. And in most cases, within 90 days or less, I began seeing those folks have similar results to the results that my mother-in-law had. And that is precisely why I'm sharing this information with you. I want to help as many folks as possible to improve their health, and where possible, get off the dangerous pharmaceuticals that they're currently taking. I mentioned that Dr. Wallach's a veterinarian and then became a physician, but I haven't told you the entire story. He graduated from the University of Missouri with a degree in soil science and Doctor of Veterinary Science. From there, he began working with Marlin Perkins of the Mutual of Omaha's Wild Kingdom on saving endangered species of animals, both in Africa and then back here in the United States at various zoos. From there, he worked on a decade-long project with the National Institutes of Health as a pathologist, where he completed thousands of comparative autopsies and hundreds of thousands of blood chemistries from hundreds of species of animals and human beings. From that research, his findings have been published more than 70 times in scientific and medical journals. He compiled all that research together and co-authored a book, The Diseases of Exotic Animals, that's currently in the Smithsonian Institute as a national treasure. He then returned to school to become a naturopathic doctor, so he can then apply his veterinary concepts in his human patients. He's been recognized with various prestigious awards, including one most recently at the United Nations for his life's work. And I'm so blessed to count him as a friend and colleague. Veterinary research has cured over 900 diseases in animals that we still suffer from. The veterinary industry and Dr. Wallach's research has shown that diseases like arthritis and diabetes, obesity, cardiovascular disease, and many, many more are diseases of nutritional deficiencies. If they were traced back, in most cases we can find a deficiency in some mineral, vitamin, amino acid, or other nutritional compound. Likewise, the veterinary industry has learned that if they supplement the animal feed with all the nutrition the animal needs, they can actually increase a healthy life expectancy of the animals. In the human model of medicine, when something goes wrong, the first inclination is to prescribe a medication. Medications, with the exception of the anti-infective category, don't heal anything. They just treat symptoms. I want you to think about this. You're driving down the interstate in your car and the check engine light comes on. Do you ignore it? Or do you check to see what's wrong and get it fixed? If you cut the wire going to that light and ignore the light, what would eventually happen? The car's going to break down, possibly, depending on what's wrong, possibly a catastrophic failure. Well, that's exactly what happens when you get a prescription. You're cutting the wire to the red warning light, the symptom of the disease that you're experiencing in the body. The body is trying to tell you something. It's trying to tell you that something's wrong. When you give a prescription, the drug, the medication, is designed to affect some biological process in the body in order to get the response that the doctor wants. In effect, ignoring the red warning light and not fixing what's really wrong. Dr. Wallach, from those thousands of autopsies in his veterinary research, discovered that nutritional deficiencies are at the root cause to all the ailments that we still suffer from. He discovered that if you give the body all 90 essential nutrients, then you're supplying the body with the raw materials that it needs to support and promote the body's natural ability to repair itself. And it's precisely this that has me so excited. Why is it that the United States spends more money on health care than everyone else in the world combined? Spending more money on health care than anyone else in the world has not paid off. The United States is 60th in life expectancy. That means 59 other countries have a longer life expectancy than we do. We're 41st in infant mortality, and only 1 in 10,000 Americans live to be 100. How can this be? It's because we're trying to win the battle of good health with medications instead of optimal nutrition. We're cutting the red warning light and ignoring what's at the root cause of the disease. Based on Dr. Wallach's decades of research, he's found that your body needs at least 90 essential nutrients to function at its best. These nutrients include 60 minerals, 16 vitamins, 12 amino acids, and 2 essential fatty acids. The foundation of nutritional health is what he calls 90 for life. Unfortunately, all these nutrients are no longer found in our food because of decades of farming practices that have left our soils depleted of these nutrients, combined with the heavy processing in the food manufacturing process, the addition of dangerous synthetic chemicals and flavorings and preservatives on our food doesn't contain the nutrients that it once did. So your first step to optimizing health is to provide your body with all 90 essential nutrients, the core nutrition needed. While the 90 essential nutrients are necessary to provide a powerful base for sustained health, ultimate wellness is further supported and customized with additional nutrients depending on your personal needs. For example, if you're suffering from joint pain, there's a 90 for Life program specifically formulated for bone and joint health. There's formulations to support healthy blood sugar, cardiovascular support. If you're active in sports or if you got a job that causes you to sweat all the time, then he designed an athletic support program for you. And then there's many more. From personal and professional experience, I know that by following Dr. Wallach's recommendations, I can help folks get better control of their blood sugar, to improve their bone and joint health, to gain control of their blood pressure, and many, many more improvements in their health and overall well-being. Again, that's precisely why I'm sharing this information with you. I want to help as many folks as I possibly can to improve their health, and where possible to help them even reduce or even eliminate the need for the dangerous pharmaceuticals that they've been taking. We're looking for a few key people to work with to help get this information out there. I'm looking for some folks that have leadership qualities, that can follow and teach a simple system, folks that want to create an additional income that continues to come in month after month, and possibly even replace their current income. Thanks again for watching this video.
All right, folks, if you want to get a copy of that video yourself, it's been posted on YouTube. You can find it by going to youtube.keithabel.com. That's youtube.keithabel.com, and that video is there. And while you're over there on YouTube, be sure to subscribe to my page and hit the little bell so you're notified when I put out new information. I do appreciate all of your kind words, your subscription, and so forth. Once we hit 1,000 viewers over there, we're going to have a special prize day where I'm going to draw some names from the subscribers and send out some prizes to you. I've got some nice little prizes already picked out and ready to go. So once we hit that 1,000 subscriber mark over on YouTube, we'll do that. Again, that video is available on YouTube. Go to youtube.keithabel.com and it will take you directly to my YouTube channel. That's youtube.keithabel.com. See you on the next podcast.
Thank you.
Thanks for tuning in to the Health and Wellness Hour with Dr. Joel Wallach and Pharmacist Keith Abell. If you found value in this episode, be sure to like and share. Also, to be notified when the next episode is posted, click on the subscribe button, then hit that little bell symbol. If you have any questions or comments for Pharmacist Keith or Dr. Wallach, you may send a private email to askpharmacistkeith@live.com or by visiting the Facebook page, Give Doc 90 Days to Better Health, Wellness, and Longevity. To hear more from Dr. Wallach, he has 2 nationally syndicated radio programs daily, Dead Doctors Don't Lie and Let's Play Doctor. Check your local radio listings for details. Also, check out the archives of his past shows at radio.givedoc90days.com. One last thing, if you'd like to join Dr. Wallach's crusade to share his message with others, contact Pharmacist Keith, and he'll teach you how to share the message and create some extra income at the same time. Contact Pharmacist Keith through his email address, keith@prosperityRx.com, or call or text at 502-212-2929. Remember, Keith is still a practicing pharmacist and can't always pick up the phone right away, so leave your name, number, and best time to call, and he'll return your call as soon as possible. Thanks again for tuning in.